Hello and welcome to the Third Sector podcast. I'm Lucinda Rouse.
And I'm Andy Ricketts. Each week we bring you half an hour of discussion and debate about the important goings-on in the charity world. And this week we'll be joined by Toby Porter to hear about the work being done by Hospice UK to keep the plight of hospices at the top of the news agenda.
But first, how much do you know or think about environmental social governance, or ESG, and how it relates to your charity's work? It's a term now ingrained in the corporate world, with various new regulations and reporting directives coming into effect to measure organisations' environmental and social impact, as well as how they govern their organisation. Now, the consultancy and recruitment provider Eastside People has just published some research into how charities are approaching ESG. It found that more than 2/3 of charities that responded to its survey don't have an ESG strategy, while just over 40% were considering one. And we're joined now by Richard Litchfield, Chief Executive of Eastside People. Hello, Richard.
Hi there.
Why is it important for charities to be tracking their ESG impact and indeed their practices?
It's becoming a really important area for all industries, and the charity sector is no exception to that. The first reason is probably needs no explanation. There's an ethical argument to it that people in our sector will already be completely au fait with. But I think I'd probably pick out for listeners two particular areas of interest. One being around public trust. And I think we hear again and again that public trust in charities is something that is really directly connected to how well we're perceived to be not only talking about our work, but also being able to measure it and explain where money is getting spent and being able to demonstrate that we are really good places to work. And interestingly, when we did research for this project, we found that it's probably the younger generations, actually more than almost all our stakeholders, that are increasingly making choices and decisions about where they donate and also where they work based on the perception of how ethical a brand or organisation is. And then maybe if I could just highlight one other area, which is around regulation. And you mentioned it in the intro to this piece. We know that regulation is becoming stiffer and stiffer for all organisations. And what we found is that within the business sector, there's increasing regulation disclosure requirements around managing and measuring your supply chains. So for all charities out there that are looking to partner with corporates and engage with corporates, we believe that in the future there's going to be stiffer requirements to demonstrate their social and environmental credentials.
Is there a difference, Richard, between how large and small charities should be approaching ESG, do you think?
It's a yes and no answer to that. I mean, on the one hand, clearly there's a big difference, right, between a large organisation, a large charity. Let's, imagine it's national or has a national footprint. Maybe it's got a property portfolio as well. So you can imagine a supported accommodation provider, social housing provider, homelessness organisation at scale. Well, it will have environmental risks as well as opportunities that are substantially more complex than a small local grassroots organisation. So in that context, absolutely, there's a difference between those large organisations and smaller ones. But what the data also told us, which I think was really, really fascinating and heartening in many ways, is that size isn't a good predictor of actually how developed organisations necessarily are. And actually, you can be mature or advanced as a small grassroots organisation in relation to parts of your environmental, social and governance practice as much as a larger organisation. And that was really important, actually, and really interesting for us, because we spent a lot of time in designing this self-assessment tool, thinking about how to make it accessible and inclusive, and really, I suppose, wanted smaller organisations not to feel like penalised or judged because maybe they didn't have the footprint or complexity of other organisations. And so there are lots of parts of environmental, social and governance practice where actually smaller organisations were probably on average a bit more advanced than larger organisations too.
And what, in your view, should be the fundamental components of a charity's ESG strategy?
I'd probably pick out two particular components. And the first one is around materiality, what is material or important to your organisation, and build a strategy around what matters most to you. So, to go back to the example I was giving just previously, if you do have property and a property portfolio, well, then measuring your climate efficiency and setting net zero targets is probably going to be an important feature. But if you don't, then don't worry about carbon footprint measurement. Don't sweat what isn't important for you. And secondly, I've tried to, I suppose, demystify what we mean by strategy. If you've got 6 different board members around the table and you ask them what does strategy mean to you, you'd get 6 different answers. So I would just really simplify it by, especially when we think about ESG, just thinking about a strategy that then leads to an action plan. So you can use our survey to gauge where your starting point is in each of the different areas, and then work with your team, agree what needs to happen, decide who's going to do what, and agree how you're going to report on it. So keep it simple, customise it, and start taking actions.
Richard, thank you very much for joining us, and we will include a link to your report in the show notes to this episode. Moving on to this week's main discussion, we're delighted to be joined in the studio by Toby Porter, Chief Executive of Hospice UK, an umbrella organisation that works to champion and protect hospice care. Toby has a wide-ranging charity sector background, having previously served as Chief Executive of Acorns Children's Hospice, and before that held positions at the global older people's charity Help Age International, Save the Children and Oxfam. Hello, Toby.
Hi, good morning. Thank you for having me on.
You've been at Hospice UK since September 2022. And on this podcast, we pointed out not long after that, in April 2023, that hospices were facing significant financial difficulty. At that point, the hospice sector was reporting a collective £186 million deficit, thanks in a large part to energy bills going up. Since then, the situation has only got worse, most recently with the national insurance increases. But there was a glimmer of light before Christmas when the Health Secretary, Wes Streeting, announced an £126 million support package for adult and children's hospices. But it's been quite a time.
It has. And thank you for reminding me of the time frame, because I remember now you reported it in April. And actually, I was tidying up some papers just this weekend and I saw what had been our first report in March 2023. And it did have quite a energy focus, because hospices obviously have quite large heating bills and electricity bills because of the services they provide. But actually the real issue for, I think, across the hospice sector, and as it is for the voluntary sector as a whole, started to materialise just after April when the pay awards came in. And I think it was 2 consecutive years of probably increased payroll costs just going up, I would say at least 10%.
Yeah.
With salaries and on costs in successive years. And I think that's what led so many hospices to say, our current business model is not sustainable. And in the end, any charity CEO knows that if you can't find your solution on the income side, that you have to address your expenditure to protect the financial interests of the charity. And that's what happened.
Yeah. But one thread of continuity during all of this time has been hearing your voice quite regularly across major news programmes. Yeah. And your latest strategy includes a pledge to be vocal in calling for the changes needed to improve equity of access to hospice services. But how are you succeeding in being so vocal? And how is it that you've managed to have this consistent voice over the past couple of years?
Well, I think the most important fundamental issue behind that is that hospices provide services that are both profoundly important to the NHS and to our wider health and social care system, but also immensely meaningful in terms of being there to support people and their loved ones at the end of somebody's life. And therefore, the fact that there's now a generation of people who have seen hospices help their family members, their community members, people known to them. And I think the reason that the media campaign has been sustained and was effective was because hospice care is so compelling. the challenges of sustaining hospice care in a tough cost of living environment appealed to people's empathy as well as to their intellects, if you like.
So has it been a case of you being invited onto these news programs as a result of that momentum, or have you been actively putting yourselves out there?
Well, I mean, we have a very proactive and high-performing media team who've worked tremendously well. But actually, I think the real achievement was actually building trust with our members, because Hospice UK is a membership body. And I think after I came in, I really prioritised, if you like, a reset in our membership relationships and really tried to set our own strategy around the priorities and lived realities of our members. There's a lot of trust there. And what happened is hospices in 2024 did something which I think just wouldn't have happened in previous years, which is they alerted us to financial challenges, to job cuts, to service reductions in advance of them being shared with their own staff and with their own public. And that meant that we were able to support them and help work in confidence with them, but also to bring the media coverage to there. So one case in point was a hospice in Litchfield in the Black Country announcing service cuts, and the day it was announced to staff, Hugh Pym was invited in under embargo to, and of course it showed the reality of a very shocked public, patients, workforce being told about the very severe cuts that this particular hospice had to make. And I think that was very effective too, and that all came from trust and just general membership rather than just sort of, if you like, the quality of the press releases or relationships with journalists. So it was a big team effort, I think, across the sector.
In terms of building that trust then with your members, how have you gone about doing that? What sort of steps have you taken within the organisation?
I think our strategy, Andy, really allowed us to sort of publicly say that this was what Hospice UK was. We were a membership body. We wanted to support our members. We had a strategy that was based around the three priorities that almost every hospice is working on, which is equity of access to their care services, quality and safety of their care services, and sustainability of their care services, which interestingly, although we focused on the money, is actually the workforce challenges are also just as much of a long-term threat to delivery of hospice services as funds are for some hospices. And that, again, would be very recognisable for many charities. Obviously, when you're involved in a campaign, you always are interested to see what the government department, the press office, says in relation to each week and how their own narrative evolves. And actually, we saw a significant improvement after the change of government. And month by month, we could see that the DHSC was really starting to really understand that this was a problem, and a well-motivated problem that they needed to solve, rather than just being very defensive about it. But I guess last summer, when we started to list the impact of the pay awards for hospices matching Agenda for Change, there was one press release where DHSC said, well, hospice charities are free to pay their staff whatever they like. But that, of course, was just not the case. I mean, that was a very disingenuous quote, because we're in an immensely competitive landscape. There's an absolute deficit for clinical staff, particularly for children's hospices, where paediatric nurses and consultants are so scarce. And I think this is a dilemma for the voluntary sector. Is perhaps 20 or 30 years ago, we benefited from pioneers who started working in the charity sector at times where cost of living was less, house prices was much less. And, in hospices now, you'll see people who are 55, 60 years old and have been working there for 30 years. And they might have been 3 or 4 years ago content to say nestle, 5-8% below a NHS salary, because they were kind of okay, and that working in the hospice was fundamental to who they were. But I think you've got a new generation of health and care workers who just do not have that leeway. And therefore, I think this is why the voluntary sector is hurting so much in the last 2 years, is because despite the incredible commitment of our workforce, if you don't offer good pay awards, you will not be able to retain the staff you need to run a proper service and to sustainably run a safe and ethical and well-resourced charity supporting them.
And then in terms of internally among your members, have you had much debate and discussion about how kind of out there Hospice UK should be? Because I know membership organisations can often struggle with that.
Yeah, really good question, and absolutely. So Hospice UK, I think, has 208 members, and the unit of our membership is a charities, not individual workers or so on. And of course, every charity's circumstances are different, and every charity therefore wants slightly different things out of their national body. And I would say that what we've done is we've been trying to position Hospice UK not as a sort of membership charity with 70 full-time equivalent workers, but as a platform, a place where people from the hospice sector can find 18,000 other people who work in the same kind of work that they do and share their knowledge and expertise. Because we tried to build that, I think people understood that there were a lot of hospice charities in really difficult straits, and the wealthier hospices, which do exist, were happy to see us focusing on the needs of the poorer 30-40% who this was very, very existential for. But yeah, occasionally I'd get emails. I remember one CEO of a children's hospice said that he blamed me for not being able to recruit staff because, of course, you know, this is the terrible balance, Andy, that you strike, is there are fantastic reasons to come and work for a hospice if you're a nurse. But as I was saying before about how precarious life is for many public sector and third sector workers at the moment after 2-3 years of cost of living, if people are reading in the paper that services and charities are threatened with closure, there's a balance, because people will say, well, I'm not sure I could risk going, because at the moment I'm employed in the hospital and I'm secure, but can I risk going to work for a hospice? So people would ring me up and say, look, can you just go easy, because we're finding it hard to recruit. So I think we wouldn't always get that right. But I think by and by, everybody feels that over the last 12 months, there is a sense of a national hospice movement and a national hospice community that fundamentally benefits every local hospice. And though everybody, of course, would come up as inevitably and quite properly with a different interpretation and set of priorities about exactly how you campaign and when, I think broadly speaking, everybody has said, look, we'll go along with this because we must help the members of our community that are struggling with these services.
And as you represent your membership, you will be acting as a collective voice, appealing to the government, communicating the needs of hospices across the country in various financial situations. What's your take on how things are going with the new government and how it is treating civil society so far?
It's really interesting, and I've been listening and learning from answers that other charity CEOs have given you to that question in recent podcasts. So here's my humble halfpenny. We would not have got the package of support we did without the change of government and without Wes Streeting personally, I think, coming into the Secretary of State position. I think we were immensely fortunate. You see, the trouble was it's not a party political point. It was just surely everybody could see as an absolute certain fact that after the Liz Truss budget, there was going to be a change of government. And I think what that meant is that, so the minister that we used to work with in the last Conservative administration and in all of my time at Hospice UK under the Conservatives, Helen Whately, very committed, very knowledgeable. You know, people really felt that she was someone who appreciated the hospice sector and was very committed to her role. But you could visibly see that trying to raise the need for a better way of working, of the government working with the hospice sector, it is complicated. And you could just see them disengaging from problems that solutions were a couple of years down the line. So this year in the UK, 660,000 people will die, roughly. in 2040, that will be 790,000. So there's this huge bulge of population that's coming down the track. So if we're not doing death well enough now, and look at our hospitals and look at our community services, how on earth are we going to help 130,000 more people in just 15 years' time? And obviously Wes Streeting and Stephen Kinnock are now engaged with that kind of time frame in a way that a end of government wasn't. Also, I would like to say that because Wes Streeting is known to have worked in the charity sector, I think that he's just understood certain things. People don't understand charities. They don't understand that November, December, January time are when the boards and the CEOs are having a really fractious negotiation, perhaps over the next year's budget. I think people in government just assume, well, if you don't agree your budget in April or even June or even August, it doesn't matter, it'll all get taken care of. And it's not through malice. They just don't understand the reality of working in a charity. Wes, for the month leading up to the announcement, he kept saying, I will do something before Christmas because I understand that charities need to know. And he understood the budget cycle, which I think was great. I think on the negative side, obviously, I think it is a shock for the voluntary sector in the UK, who see themselves as so supportive of a, if you like, progressive agenda and helping the most vulnerable members of our society. It obviously was a huge shock to get the national insurance rises. And I personally feel there should have been much more attention given to the impact on the voluntary sector. And I think it was a mistake. And I think, to my mind, the mistake that the Chancellor and the Prime Minister made is that they just didn't give themselves enough options. And I personally find it a great regret that they didn't come in with much more of a narrative about, look, the previous lot have left a terrible financial situation. I don't think anybody really disagreed with that. It will take us a few months to get on top of it, and then we'll come back with something that is fiscally responsible and helps us deliver our commitments to the British people. In the end, so much had been ruled out that I think it's absolutely right, the criticism the government's had from the charity sector, from national insurance. I think it's a massive kick in the teeth for a sector that we're so conscious in the hospice sector that there are so many deserving causes and charities out there who haven't had the support we have. I'm hoping that over the next year or two, you'll really start to see both meaningful strategic and mission, but also financial advantage to a government that is much more committed to working collaboratively and in partnership with the voluntary sector.
I'd like to move on to your own career journey now. So you, at one point, you mentioned Oxfam, but you were also responsible for Save the Children's global emergency work. Now you're in the national hospice sector. So it's quite a unique profile in some ways. How easy has it been to move between those different subsectors of the third sector?
I found it easy in terms of, for me, it's just if you're passionate about the job and you have skills and experience you can bring to bear. I loved the international sector. I was very aware by the time I left in 2013, 2014. And I supported this, by the way. There was a big change in the political economy around leadership and representation in the international civil society, not-for-profit space. I used to go to Davos and see Winnie Byanyima from Oxfam, who's now the UNAIDS Executive Director. Danny, who you had on last week, Danny Shrishka-Naraja, who was then for Civicus. You could sense that Help Age International, such an interesting charity. And what our elevator pitch was there are 2 billion people in the world over 60, and 40% of them live in middle and lower income countries. Well, what on earth was a 45-year-old from Oxford doing as their chief executive? I mean, it quite clearly Help Age should be led by an older person from a developing or middle income country. So for me, it was easy. But of course, headhunters, and when you get to a certain point in a third sector career, a lot of your moves will be through search companies. And I think that I just felt I wanted to leave the international sector. My kids were not leaving home, but probably 4 or 5 years elder kids from going to university, and I loved my work, I loved my home life, but they were unaligned. I literally saw an ad in a discarded newspaper in a carriage for a children's hospice based in Birmingham. And something made me just pick it up and tear it out. And I did some research, and I saw it was the right side of Birmingham for the road commute from Oxford, where I lived. And I took a flight to Japan later that evening, and just on my way to the airport, I rang the number, and actually Acorns didn't use a agency. I got straight through to Janet, the director of people. And if she'd said anything like, "Oh, we're looking for someone from the sector, from healthcare, from domestic," I would have left it. But she was great. She said, "Do you know what? You sound really interesting. I have got some traditional candidates, but I would love to have a wild card to put in front of the board." So that's how I got the job in the sector. But, 6 years after that, it was funny because I guess, like a lot of people, I looked in my last year before I got the job after the pandemic. I started going back to some of the search people I'd worked with. And my friends, one in particular, she wanted me to go in front of UNICEF. And I think she put something like 8 people in front. And I'd done international and the child sector in the UK. And I was the only one of her recommendations that didn't make the shortlist or whatever she was presenting. And she said they just couldn't understand why you would leave a £30 million international organisation and go and run a children's hospice charity. So there must be some story, there must be some drama. And there really wasn't. I just wanted a different life. I work to live. I love my work, but I work to live, not vice versa. And actually, it was far, far, far harder to be a CEO of a £12 million cash-strapped children's hospice in Birmingham than it had been for a 30 million quid international charity that most of its income came from a couple of grant sources. So I think my advice to people is mix it up. And I think portfolio careers are fantastic, but we also need trustee boards and recruiting managers to not put the blinkers on as well, because in the end, other people might limit your options in a way that you wouldn't put limits on your own ambitions and capability.
Just as a final question for you, bringing back to the beginning of our discussion, I thought it was really interesting to hear how your media prominence in recent months and years is largely attributable to the trust that you have fostered amongst your member hospices. But you have been on the news quite a lot. I just wondered if you could share any tips for other charity leaders who perhaps don't have quite as much media experience as you.
Okay.
What's the key to success in this area?
Well, I think firstly, really obviously love your work and always welcome any opportunity to tell people about what matters most to you as chief executive. And I think what I said to you before, the amount of people with lived experience of hospice care who proactively want to become advocates and spokespeople, that is the most important asset. No one remembers me. I mean, you did, that's nice, but you're a professional charity journalist. But what people remember from the coverage is inside the hospice and hearing from people literally on their deathbeds saying, "I can't bear the thought that this might not be available for someone in a year's time." I work with an incredible level of trust with our own media team. So you need to resource media and comms teams adequately. And even when times are tough yourselves, don't make cuts that turn out to be false economies into comms functions or even fundraising functions, because those are the assets and tools that might help you, if you like, get to safer waters.
Toby, it's been so interesting to hear you talk. Thank you very much for joining us.
Thanks for having me on.
We hope you enjoyed our discussions with Toby and Richard, and that's it for this week. Next time, we'll be returning to the topic of impact measurement, this time around how to evaluate and measure systems change thinking. If you'd like to give us any feedback or have a topic you'd like us to cover in future, there are 2 easy ways of getting in touch. You can either complete our short anonymous podcast listener survey or send me an email directly. You can find details of both in the show notes to this episode. Thank you very much for listening. Our producers are Till Owen and Nav Powell.